This time last year in April, there was a number of guidelines all released looking at different adaptations that could be made for patients with lung cancer in terms of their treatment. I mean, it was across different cancers, but thinking here specifically in lung cancer, including an article in Clinical Oncology which looked at changes that could be made to radiotherapy dose fractionations, really in terms of reducing the number of visits patients were going to have to hospital, because particularly patients with lung cancer are on the shielding list. So it was to really minimise the number of times they were coming to hospital. So what we then did was put together a national UK-wide data collection looking at the use of these changes and what sort of changes were introduced, with the aim ultimately being to see if we could see what the effect of all the changes were. So as things stand, there's 26 UK oncology centres entering data into a central anonymised database. Each centre's got ethical approval from their own centre to enter the data. We've collected data for all patients with stage 1 to 3 lung cancer treated between the beginning of April and the beginning of October last year, so 2020. The data that was presented at ELCC was from data extraction at the end of November, which was 1,117 records from, as I say, 26 UK oncology centres. Obviously, the data entry is ongoing, so we've now actually got more than that. But looking at those, just over 1,000 patients. Firstly, of the 1,117 patients, there were 160, so 14%, who'd had their diagnostic investigations affected by the pandemic. Most commonly, 4.6% didn't have histology obtained. There were also patients who didn't have nodal sampling or an up-to-date PET-CT or pulmonary function tests. So that was the changes in the diagnostic investigations. In terms of changes in treatment, there were 415 patients, so 37%, who had a change in treatment from what would be considered their centre standard of care. The most common change in 19% of patients was that they had a different radiotherapy dose fractionation, but there were also patients who 8% had radiotherapy instead of surgery. Some patients had chemotherapy omitted or reduced. And what we found was that those patients of better performance status, so performance status 0 or 1, were more likely to have their treatment changed than those of poorer performance status. And looking particularly at the changes in radiotherapy dose fractionations, what we found is that more patients are having hypofractionated or ultra-hypofractionated radiotherapy as a result of the pandemic, particularly those patients with early stage disease. And in stage 3 disease, there's been very few patients getting schedules of less than 2 gray per fraction, and there's been an increase in patients who have sort of 3 to 5 gray per fraction schedules. So really what we've found is that diagnostic investigations have been affected by the pandemic, and people are changing their management of patients as a result of the pandemic, really mainly in line with the guidelines that have come out. People are now sort of retrospectively entering cases from the time period sort of April to October. We didn't want to sort of continue burdening people with having to continue collecting the data. I think we got really, covering that period. We've done further analysis more recently, which does show that the period in May was really when the highest proportion of changes were happening, and then that started to tail off into sort of August, September time.